Hello, my name is Selina and I'd like to share with you this presentation I recently gave at the Royal Brisbane Hospital in November 2023. Our event was called Cafe de Lily, a collaboration of community organisations and the hospital. Thank you to the amazing Auntie Julie Allen, for getting us all together. I hope this presentation can help you to advance any work you do to assist people needing supports across these systems. I'd like to acknowledge the traditional owners of the land on which I'm speaking and that we gathered for Cafe de Lily, the Yagara and the Turrbal people in Brisbane region, and traditional owners across the whole of Queensland. We value their wisdom and their collective leadership, and we can learn so much from their collective approaches to gathering and meeting. First of all, I'd just like to speak briefly about Support Groups Queensland and my own organisation. So we're 40 years old. We are a health promotion charity. We are partly funded by Queensland Health, and we work with over 1,200 support groups across Queensland. Our support groups can be for any kind of health and wellbeing issue that people have, everything from cancer, mental health, being a carer, rare diseases, dementia and autoimmune conditions, anything that people want to get together and support each other through the lived experience of whatever health challenge they face. So why do support groups work? The research evidence is that they give people access to new information. They give them increased capacity to manage their health concern, whatever that is. Gives them increased capacity to advocate for themselves when they're outside the group, because you have that feeling that you're not alone, that peers have your back. And increased social connections. For some health conditions, the experience can feel very isolating, and people can feel like they're the only one who understands what they're going through. Even when we have helpful and supportive family and friends, often they don't know too much about what health condition we're facing, and those increased social connections can make the difference for a lot of people. So what do? We help peer support groups to help their people, whoever members they have. That can be 5 people or 500 people. We support people to start new groups or explore alternatives to starting a support group if perhaps the support group is not the best approach for what they're thinking of. We help people to find the right group for them. And this finding a group for someone has now often referred to as social prescribing. So social prescribing is where a health professional refers patients to non-clinical supports in the community. It's an umbrella term and it covers a range of possible interventions. We have the idea that you are able to give one robust and thoughtful referral to someone, to possibly an intensive long-term motivational interviewing process with a link worker, service navigator, caseworker. So there are many roles in the health system and in community organisations where social prescribing is a core function of what we do, and it's often, people might think that's what I do all day. I help people, refer people to groups and to good supports. If it's not a core part of your job, it can also be that asking one leading question in a brief health interaction or community interaction with someone can lead to a major improvement in their health, connecting them to their peers or to something that they liked to do in the past maybe. This is called opportunistic health promotion. Social isolation and loneliness has received much more attention in the last decade or so. One key quote that is often used is that the impact of loneliness on our health is the same as smoking 15 cigarettes per day. This is from a 2010 study by Julianne Holt-Lonsdale, and it's famously been quoted by the US Surgeon General, Dr. Vivek Murthy. Dr. Michelle Lim, who is the scientific chair of Ending Loneliness Together in Australia, noted that ending social isolation and loneliness is everyone's responsibility. And I think that is the key principle of what we're trying to do with our collaboration across health and community. So the results of effective social prescribing, there's a range of international studies, and generally they're showing that an increase of 18% or more showing that a change of 18% or more happens with repeat attendances in primary healthcare settings. So the person is having needs other than their immediate health condition and the medical intervention side met, and they don't need to attend so many appointments. Also recently we have had a major review in Queensland of social prescribing, and this included an 18-month evaluation of social prescribing. And thank you to the work of Leah Sharman and the team at University of Queensland and their whole group. Their report shows reduced loneliness. People showed improved perception of their health. They had improved social trust and improved wellbeing. This study also shows that the 18-month mark, peer support groups were one of the major referrals that showed continuing engagement. So from that starting referral 18 months before, many people at 18 months were still engaged with those peer support groups. So to me, social prescribing has 5 key principles. They are: meet the person where they're at. The person you're seeing or the person you're with might not be prioritizing what you would think they would prioritize, but if we can just start where they're ready to make a change, that can lead to further changes. So meet the person where they're at and not what we're thinking should be their priority. The second principle I like is to have a sizzling hot referral, a red hot chili referral. Instead of giving someone a brochure or talking about a good 1-800 number, talk about, I know the leader over at this service, they're really fantastic, I think they'll really be able to help you out. Please get back to me if they don't work. This is the kind of questioning and prompting that we can give someone to give a sizzling hot referral, and not just this is a really good service, here's the brochure. It's also important to acknowledge the fear and trauma of reaching out. Everyone has had the experience of being the new person, or walking into a room and you don't know anyone, or finding certain environments quite overwhelming or threatening. And we need to hold on to that experience so that we can really relate and empathize with a person who maybe has had bad experiences, or they're not in a good state with their health or well-being, and that kind of reaching out seems quite overwhelming. In some social prescribing projects, the person can be accompanied by a support person, a link worker, a carer, and that's a great model for a lot of people to engage with, where they might need that more help to try something new for the first time. The next principle is shared information and honest, open feedback. I can do the best that I can to refer someone to a really good support group, but I can't talk to them all every week. So if someone doesn't get called back or something happens, it's great if the person I'm working with has called me back and said, they didn't answer, I'm not sure what's happening, they weren't there. In one case recently, our group had gotten invited to a special seniors event, and it was the one meeting that we weren't, where we said we are every Wednesday. And I got a call saying, "Where are you? You're not on today." Just one time in the entire year that we weren't there. Also, we can prescribe the basics for most people and most situations: that safety, food, friends, sunlight, sleep, movement, all of those things will produce an improvement in someone's health. I say movement there because it might be just walking up and down a corridor in the hospital, or it might be park run or something large and strenuous like that. So for each of those elements, there's going to be different levels that we can engage with, depending on our own health and well-being. But to me, those are the 5 key aspects of social prescribing. So I don't want to give the impression that referral and getting someone engaged with a new support group or new service is easy. In something like hoarding, where we work with, we've worked out 10 areas of conversation that we need to have with a person who is struggling with a hoarding disorder. And you can see, I won't read them all out: housing, safety, everyday essentials like showering and cooking, fun, bills, all of those elements. So you can see that with a complex condition, there might be lots and lots of conversational areas and change and behavioural modification that the person needs. But social prescribing offers us maybe the opportunity to just start working on one of these aspects, and as a worker we can pick or the one that we are either employed to or we're comfortable engaging with, and we have those red hot referrals, so we know where the right person or the right place is to refer the person for other issues that they might face. So these are my opening questions when I'm working with someone who's just starting to engage or thinks they might need to get in touch with our support group. So first of all, we have do you know anyone else who's going through this? I've met people who've had serious things like a brain injury, other things, for 10 years, and they've never met anyone else who has their condition. So if we just ask anyone, do you know anyone else who's going through this? And we can refer them to a patient-led organisation. For most conditions, health conditions, there is an organisation in Australia. Sometimes they'll be online, especially with the rarer conditions, and because Queensland is such a spread out place, sometimes we will have to engage online, but also there are often local organisations that can be a help as well, but maybe not quite what the person was thinking that they would be available to them. My next question is there something you like to do that would take your mind off it? Sometimes people get so caught up with their health concern that they really don't have any time to do anything fun. One of my carers told me how he's last year he attended 261 medical appointments. So that doesn't leave many days where you're not engaged with a health appointment. This idea that just even something casual and small that you like to do, that you still or re-engage or you still maintain it and prioritise it in your life. My other question is, have you got someone you can phone? So I like to call this the 2 a.m. 2 a.m. call. That everyone should have someone they could call in the night We of course have emergency services, and you can call 000. You can call Lifeline as well in an emergency. But have you got someone, if you're just feeling alone, or maybe it's an anniversary that's difficult for you, have you got someone who you can call who wouldn't mind if you called later at night? So explore the person's current connectedness. I was at a wonderful support group meeting where we had this conversation, and 2 people agreed to be their emergency call in the night person because they didn't have anyone that they could call if they had a non-emergency but sad or difficult time. So some examples I thought I put up regarding how support groups are very powerful and help people to get through. One person recently told their new group leader that they had started rationing their antipsychotics to pay their rent. So the group leader secured emergency relief to pay for the prescription. They walked them down to the chemist, they assisted them to check in with their psychiatrist, and they arranged a referral for housing assistance. So one small conversation, and our group leader, who is a volunteer, was able to swing in a lot of supports for that person. Another group recently had a member's wife in hospital after a serious accident, so they started a meal roster, and so that family never came home from the hospital or from work without a hot meal waiting for them. And obviously that's led to an earlier release and a more calmer release once that person's wife was able to be released from hospital. Another group I was with talked about their early warning signs for an anaphylaxis reaction. And they talked about having an itchy head. And another member in that group realised that they'd never recognised that as a sign of an a threatened anaphylactic reaction. So that was like a wonderful example where someone who's lived with a condition for a long time can give good information to people who are maybe just newly diagnosed. We have a lot of wonderful support groups and community groups. These are groups on Brisbane's north side, some of them with a larger footprint than that across Queensland. QDN has a state-based footprint, and Polio Australia has an Australia-wide footprint, as does Family Drug Support. So this is just, and for doctors and medical people themselves, handinhand.org.au is peer support for professionals in this area. So all of these services are quite fantastic, and for every client we can do the best we can to make a sizzling hot referral, a red hot chili referral, and connect them to things that are specifically going to help them to manage their health condition better. So I encourage everyone to tell people about the power of people supporting people, and use social prescribing and refer people to a support group. These are my details if anyone would like to get in touch with me about support groups and about the power of support groups to support people. So thank you, and I hope this information helps you with your work to support people. And I encourage you to have a sizzling red hot chili referral network.